Hi, this is Dr. Linda Burke-Galloway, author of The Smart Mother's Guide to a Better Pregnancy, blogger and OBGYN physician, and I just happen to have a copy of my book. I want to talk to you today briefly about the kinds of questions you need to ask when you are thinking about who's going to take care of your baby. If you decide that you want to see a midwife, you need to, of course, check out her credentials, but you need to ask a couple of questions. You need to find out who is the OBGYN physician that's going to be backing her up, because all midwives need to have an OB physician to back them up in the event that you need an emergency C-section, and you actually want to meet that person prior to an emergency occurring. If the midwife delivers at a birthing center, you want to make sure that that birthing center has the capability of performing a C-section, because stuff does happen, unfortunately. If you decide to see a family practitioner, same thing. If the family practitioner is trained to do C-sections, fine, no problem. But if the family practitioner has not had training to do C-sections, again, they're going to need an OBGYN physician, and you want to meet that person before an emergency occurs. If you decide that you are going to see an OBGYN physician, then of course you want to make certain that the person is board certified, because in this day and age, most insurance companies will not cover you if your physician is not board certified. You also want to make sure that you check out the Board of Medicine in whatever state you are, and the Smart Mother's Guide has all of that information for every state in our country, in addition to Puerto Rico and the Virgin Islands. You want to go to the Board of Medicine because you want to make sure that that OBGYN physician does not have more than 2.5 malpractice suits. That's the average number of malpractice suits that an OBGYN can anticipate incurring during the course of their professional career. If you see that this person has 5 or 6 malpractice suits and settlements of $1 million or more, or even $500,000, it's really about numbers. If this person has a lot of malpractice suits, buyer beware, because there may be a problem. The other thing you want to do is you want to check out your OB physician with the labor and delivery nurses. I love labor and delivery nurses because they really know what's going on. They will be able to know if this doctor shows up on time for the delivery, or if this is the kind of person who comes in at the last minute. All of these questions are very, very important, because the outcome of your pregnancy, which we want is a healthy baby, it begins with the person who's going to take care of you. Until next time, this is Dr. Linda Burke-Galloway reminding you that a healthy pregnancy doesn't just happen, it really takes a smart mom who knows what to do.